full year since the first case of Covid-19 in our country. You'll know of the danger, the difficulty that we've faced since then, the hunger, the hardship, the disease, sometimes the division that all of this has caused. For the moment, there is hope. There are vaccines being rolled out. In some countries, the number of new infections of the coronavirus has dropped dramatically in the last few weeks. Here, we seem to be in a trough. Well, what has the last year been like? What have we learnt? What do we need to do differently? Malan is the editor-in-chief at the Bhekisisa Centre for Health Journalism. Sibongiseni de la Glazo is the spokesperson for the nursing union Tenosa, representing people who have been on the front line. And Chris Vick is a communications consultant. He's been working in various capacities during this time. Thank you all both for joining us, all three of you for joining us on this Friday afternoon. Malan, if I may start with this question. Over the last year, what has government done right?
Well, I think, we started off acting decisively and we acted very quickly with the lockdown, so that was a good thing. And there are other measures that we implemented quite rapidly. For instance, masks, when evidence became available, the government was quick to make regulations around it. Many other countries were slower. And for instance, treatments like the steroid dexamethasone was implemented on the same day that the World Health Organization announced that it could help people who were severely ill to reduce the death rate. So that was good, but there were also things that we didn't do so well. And some of those include that there was some irrational regulations. I'm sure you remember the closed toe, open toe, and that you weren't allowed to buy all types of shoes. There were some regulations that were not necessarily all evidence-based. For instance, sales ban, or it wasn't explained very well. Some regulations were explained well, like for instance the alcohol ban eventually was explained well, but that didn't go to beaches wasn't explained that well. And of course there was a lot of corruption with the PPE, and there was also military and police abuse. And in terms of communications, I think there were pockets of excellence, but it wasn't consistent.
Well, Chris Vick, I'd like you to pick up on that. I mean, communication has been absolutely key here and in so many other countries during COVID-19. Out of 10, what would you give government during this time for communication?
I think it's difficult to apply a consistent score, because I think government has had good moments and bad moments. I would say the first 3 months, government would have probably got a 6 out of 10. But in the last few months, I think communication has improved significantly. If you want to put a number on it, I'd say 7.5, possibly an 8. But I think what's concerning is the reason that we set up COVID comms, which is a volunteer network of comms professionals, is we felt that a lot of government's communication was too scientific, too English, and difficult for people to access. And I think those arguments still apply to a large extent. When I watch some of the TV coverage of these incredibly dense scientific presentations with charts and curves and ZYs and 512s, I think that's important. It's important for scientists and important for health journalists and practitioners. But I think the public, the people who we need to mobilize the most effectively, are still not getting plain language communication in all South African languages in a way that they can understand and act on. Because ultimately, COVID-19 requires behavioral change, and behavioral change has to be based on science, but it also has to be based on communication which is effective, simple, and in your mother tongue. And I think that's probably the biggest shortcoming of what we've seen government doing now.
One of the things that astonished me, Chris, is how quickly almost everybody in society started to wear a face mask. It showed you now, I mean, there's no way that government has a person who can go and knock on every door, go and speak to people in every shack, go and speak to every waste picker, on the street and say, wear a face mask. The number of police and soldiers we have just doesn't do that. It shows you actually how important it is, I'm afraid, for government to communicate effectively in the media. Literally, I was only in urban areas, but everyone was wearing a face mask in the space of about 2 weeks.
Well, I think it demonstrates the effectiveness of simple communication, because up until the COVID app was launched and up until the vaccines were procured, there were 3 messages: wear a mask, observe social distance, and wash your hands. And those are very basic messages which are quite easy to communicate. the difficulty is they were often couched in scientific language. And it was only once we started to see ministers, for example, being forced by someone like the late Jackson Mthembu to mask up, to wipe the microphone in press conferences, etc. That kind of visual leadership, I think, has been important. And I think the practical demonstration of what we can do. Because, as I said earlier, it's about cutting through the science and making it very basic and very easy for people to understand that it might be an inconvenience. The lockdown caused great difficulty. The pain of friends and family who've contracted COVID-19 is massive, but the mitigating steps are actually quite simple. And that's what we believe as COVID government should be communicating. And I think our concern with the vaccine campaign, coupled with a drop in infections and a drop in fatalities, is that people are literally going to let their masks down, that they're going to relax their guard, which means we need even more simple, repetitive information about those three basics, about the importance of the COVID app, and about the importance of getting a vaccine. The vaccination is safe, it works, but it doesn't mean that you stop wearing a mask, washing your hands, and sanitize.
There's so much more to talk about there. Sibongiseni Delihlazo, I mean, you represent nurses. And I've got to tell you, Sibongiseni, one of the things that I will never forget from this time was, I think it was your union, but certainly it was a nursing union which sort of published a report. And in that report were details of how nurses at a hospital in Gauteng didn't have face masks, didn't have gloves, and literally were using plastic rubbish packets to protect themselves. I mean, I found that just incredible that that was happening. I mean, for you, for nurses, for that image, trying to treat people while protecting themselves using plastic packets, that must have been a terrible moment for your members.
Well, indeed, Stephen. Greetings to you and to my fellow colleagues over there. I think it's not been an easy period. It's been a very bumpy year. Healthcare workers have had their fair share of troubles and have fair share of, of challenges that were never resolved by government. I think if there was ever to be a lesson, one lesson learned out of this crisis, it will perhaps be the importance of ensuring that your healthcare workers are protected. I think you just mentioned it, Stephen, and it still continued up until we got into the second wave. The area of procurement of PPE is an area that we're complaining about every day, and we have lost healthcare workers. Many healthcare workers contracted the virus, and many of them were telling us that the quality of this PPE is very questionable. In fact, some of them would show us that they were given facial masks, clearly written not for use, not for medical use, not for use in a medical environment. Some would be clearly written dust mask, and yet they would be given to healthcare workers. So the issue of quality became a serious matter, and I dare say corruption also robbed us, of PPE in this country. You know how millions of rands just went down the drain through corruption. And that's the money that could have gone to procuring PPE, quality PPE for our healthcare workers. And I think we should be grateful to the likes of UCT who did a study, looking at the quality of PPE, because we're making a lot of noise, and unfortunately we're not providing something tangible for government to see. But we're very excited when UCT did a study. Of course, the SIU report itself in their investigation proved that the suppliers of the PPE to government were not sticking to quality requirements. And that PPE found its way to healthcare workers, and we are sitting here with more than 700 healthcare workers who have left us under dubious circumstances where we feel they could have been protected. And we still feel that, the monies that have been recouped by the SIU should really be put back, into buying PPE, because we're being warned of a third wave. We never thought that healthcare workers would still be as energetic to deal with the second wave even. And I fear what would happen if we were to really face the third wave.
It also brings up the question, Sibongiseni, of health administration. I mean, there was corruption being a major issue, and we're not going to forget that. We're going to come back to that again in a moment. But there's also the issue of administration, proper use of resources. Has administration improved? I mean, at one point during the height of the second wave, we'd been people being treated in parking lots simply because it seemed that things were a little bit of a mess. Has the administration of hospitals improved?
Well, I won't say it has improved at all. Of course, we're in a crisis mode, and we never expect things to be done quite properly, especially if you were neglecting this area, very crucial area of administration. It's an area that we're still lacking in the country, and I think it's an area that we need to strengthen. We've got various healthcare settings, and our main concern has always been healthcare settings in the rural areas. And we still believe that many patients were lost due to poor infrastructure in our facilities. And many patients who reside in far-flung areas in the rural areas where public transport is from 5 a.m. to 6 p.m. And if you get sick, after 6, there's no transport available to take you to the facilities. We feel that is an area that needs to be looked into. Well, there are clinics, there are hospitals, they may be hours away from where they are. But we feel that capacitating such facilities to ensure that at least you've got, the equipment that would save patients' lives while you are waiting for the ambulance or referring the patient to the nearest provincial or tertiary institution. So it's an area that we do not think it has been improved. And human resource in this case is a serious matter. We've been making a lot of noise about the need to augment our numbers. We're very worried. And that we have still withstood the ground and still talking of 94.6% recovery rate is just a work of miracle, really. We never thought would have achieved such high rate. But I still think that we could have saved more lives had we really invested in our healthcare. We still believe that our government sees healthcare service as an expense instead of an investment. And without people being healthy, there's not going to be any economy, and people will not be able to take part in economic activities and feed their families. So it's a serious area, and research has proven, and advice from the best is showing that you must look into your healthcare system. Look at our budget. Our budget health has dropped to number 4 in terms of priorities, from number 2, following education. So that's just an extent to which I do not think we are moving in the right direction in terms of strengthening our healthcare settings.
Bhekisisa de la Glazel, the spokesperson for the Nursing Union, he will stay with us, so will Malan and Chris Vick. Back with a conversation commemorating the year of COVID-19 in South Africa. Stay with us. We continue our conversation looking back on the year of COVID-19 with Malan from the Bhekisisa Centre for Health Journalism. Chris Vick is a communications expert with COVID Comms, and Bhekisisa de la Glazel is the spokesperson at the Nursing Union Denoso. Malan, in a way, we've gone up and down. I think some people use the phrase roller coaster. And at the moment, we're in a space where there's a sort of trough of new cases. We're on lockdown level 1. Things maybe feel a little bit better after the end of the second wave. But more important than all of that is the vaccines that have started to be rolling out, and they're really providing some hope. However, for many people, there's a cynicism not born out of the sort of silly theories against them, but born out of the kind of corruption scandal we saw around PPEs, and general cynicism around whether government can actually inject millions of people that it needs to do in such a short space of time.
Yes, I think there's a lot of anxiety around it, and I think this anxiety that can we perhaps move quicker with the vaccines, and also within the broader context of the world where there's so much vaccine inequity access, if you look at the access between rich and poorer countries. I think you raised that, do we have the ability to roll it out, quickly enough? I think very few people can answer that question. We've never in the history of our country rolled out an adult vaccination campaign. We have rolled out large quantities of drugs, for instance, antiretroviral drugs, and we've done that relatively successfully. And we also provide TB treatment relatively successfully. Can we do this? We can only use what we've got, and we can hope that we have a strategy that we will stick to. What we see at the moment is an implementation study, which is relatively small, but we've seen how we have distributed. We've managed to use our first batch of 80,000 vaccines within the allotted 2 weeks. In fact, we finished it before, and we're busy with a second batch. So there is some reason for hope. In terms of corruption, I really hope that we are able to learn from the PPE corruption so that we are able to implement better procurement systems. I'm not so worried about the procurement of vaccines, because only the government can do that. I'm worried about the distribution contracts. So when the vaccines get here, to contract companies to distribute them to provinces. I'm hoping that we can learn from the values, that we can learn it. We must be transparent. It wasn't transparent contracts during the PPE periods. And I'm also hoping that we can learn to put in a place, for instance, at the moment we are looking at more central distribution procurement systems than provincial ones, that we can put in systems in place that and take from those lessons from PPE and decrease that amount of corruption.
Chris, Vic, this also requires quite good communication because of the cynicism. And I mean, it's well-founded. I mean, these are some people made money, millions. Someone bought 5 cars in an afternoon because of PPE corruption. No one's yet in jail, although the Special Investigating Unit is doing its work. How does government convince us that it will be able to do a vaccination program without corruption?
Sorry, I think it has to do it, and it has to do it properly, because the net effect of the PPE scandal, the conflicting messages around lockdown regulation, Mia's point about whether you could buy open-toed shoes or not, the face mask issues that Bhekisisa has raised, and the questions around the procurement of the vaccine, which are compounded by stories like the one in the Malan Guardian today about doctors' spouses jumping the queue to get vaccinated. All of this contributes to a trust deficit. And I think that's government's particular challenge right now, is it's asking South Africans to trust its ability to manage the pandemic, the mitigating precautions that have been put in place, and the rollout of a pandemic to such an extent that we have population immunity. It's a massive challenge. And I mean, my only advice would be just keep getting as many things right as possible. Recognize that the trust deficit exists and try and address it as squarely as possible, which speaks to the 2 points that both Bhekisisa and me have made. There's got to be more transparency around what is going on. There has to be a much clearer set of messaging that comes from government so that people's trust is rebuilt. And I mean, I say that knowing that there are signs of tax revolts and there are people who are getting increasingly irritated with the ANC as a governing party. It's a very, very difficult climate in which somebody like the president or the minister of health goes out and says, trust us, we're going to do this. And I do think that the fewer missteps, the better. The more direct communication in plain language and in mother tongue, the better. But ultimately, it's about getting it right, because you can spin it, you can have photo ops at the airport, but the minute people find out that a vaccine is not that effective or that the expiry date is a problem, it's a setback for everything. It's a setback for the broad national campaign around the pandemic. It's a setback for faith in government, and it's a setback for the communication efforts that many people are involved in.
Well, the people who are being vaccinated now, of course, Sibongiseni de la Hlazo, are your members, the members of the nursing union, DENOSA. How are they feeling at the moment? I mean, we've seen nurses getting onto the database, going through the vaccination process. Generally speaking, they're very, very pleased and welcoming the vaccine. But it's actually, in a way, going to be what happens to your members. I think that's going to set the tone for the rest of this rollout. How do you think it's going so far?
Well, indeed. I think it's going very well so far, and we're quite impressed. Of course, it's a very small batch that we are dealing with, the 80,000, and of course now we're into the second batch. And already we've got 92,000 healthcare workers who have been vaccinated, and that is promising. Of course, still a long way to go. We've got 1.25 million healthcare workers. And it's in our interest that every single healthcare worker gets vaccinated. And we're extremely worried because of the time when will the third wave arrive, because we know with the J&J vaccine, it will kick in after 28 days. So we just hope that we speed up the process to ensure that by the time we have to deal with the third wave, many healthcare workers would have developed immunity. And it's a process that we are following with great interest. And of course, we understand the circumstances surrounding that, the fact that this is a study phase, and we're very impressed by it. And I think a lot of communication also still needed to be cascaded down to healthcare workers in this case, because initially, if you remember, there was quite some hesitance, from their side. because of many discussions on the airwaves and about people casting doubts on the actual vaccine itself. But that has since improved somewhat, and we are starting to see a number of healthcare workers getting vaccinated. And from our side, we've been very worried because it has been proven to us that we can't rely on the PPE. Therefore, we've got many healthcare workers, many of whom have got comorbidities, and we feel that getting vaccinated. And of course, there is information out there. We just need to be supported to ensure that every single healthcare worker gets as much information. I do not think that government has done well in that regard, especially because majority healthcare workers are working for government, which I feel they could have done much better to ensure that the uptake from their side, because if you've been informed by how much they know about the vaccine itself. But we're happy that more and more now are coming out, and you're starting to see long queues in healthcare facilities. That is promising. Of course, a lot of work still needs to be done. If you talk of second phase and third phase, that's where a lot of work would be needed. And we hope that government's also following this to ensure that healthcare workers are supported, because currently they are demotivated. They've never had their interests, affected since April last year. And yet they've done their work very well, and despite their unhappiness. But we think government can do a lot also to support them.
Malan, we've spoken about what government needs to do to try and restore faith almost in government to roll out COVID-19 vaccines. You've seen what the nursing unions are saying. But key to this, unfortunately, is also the science. There's been some, I thought, fairly exciting science this week that seems to suggest that people who have had the second variant of the disease, the variant that's dominant here, the V2 variant, are also protected or have some immunological response to protect them from other variants. So long as the science kind of stays where it is and the Johnson & Johnson vaccine works, I mean, this is the moment that maybe we can start feeling hope, so long as we don't get another very different variant.
Yeah, I think you raised the point that and implied that maybe we can develop a vaccine that works for this variant, and then it will also work for other variants around the world. That we will have to see from science, and I think Prof. Karim will be able to speak much better about it after this than me. But the point that is important to remember is that it's important how we distribute these vaccines. If we're not going to do it equitably around the world, and if we don't treat COVID-19 as a pandemic as opposed to pockets of countries with vaccines, we will never, ever get rid of this pandemic. Because it doesn't matter if a rich country can give everyone vaccines. If there are countries that don't have vaccines or have very small quantities of vaccines, we will see more mutations and we will see variants, and those variants will spread. So the most important principle we can fight for going forward with COVID-19 is equity, so that we reduce inequality and we make sure all countries get vaccines. And one of the mechanisms that the World Health Organization has created for that is COVAX, and to encourage countries to participate in that.
Well, it's a very, very important conversation. So many different things, of course, to talk about there. Malan, the editor-in-chief at the Bhekisisa Center for Health Journalism, thank you very much indeed. Bhekisisa, the spokesperson for the nursing union, Tenosa, and communications expert at COVID Comms, Chris Beck. My thanks. It's Friday afternoon.